Hello everyone. Today, we're delving into the world of a medication called furosemide, commonly known by its brand name, Lasix. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Furosemide, recognized by its brand name Lasix, is an oral tablet or injectable medication that falls under the category of loop diuretics, often referred to as water pills. Its primary function is to help remove excess fluid from the body by increasing the production of urine. This action makes it particularly useful for treating conditions such as edema, fluid retention, associated with congestive heart failure, liver disease, or kidney disease. Additionally, furosemide is prescribed to manage hypertension, high blood pressure, by reducing the volume of fluid in the blood vessels. By alleviating fluid buildup, it also helps to reduce symptoms like swelling in the legs, feet, and other parts of the body. Warnings: Furosemide comes with several important precautions. It's not intended for individuals who are unable to urinate or have anuria, a condition where the kidneys are unable to produce urine. Because furosemide can lead to significant water and electrolyte loss, it's crucial to monitor for signs of dehydration and electrolyte imbalances, such as low potassium levels, which can be dangerous. Those with severe liver disease should use furosemide with caution, as it can lead to hepatic encephalopathy, a decline in brain function due to severe liver disease. Before taking this medicine. Before starting furosemide, several factors need consideration. It's essential to inform your healthcare provider if you're allergic to the drug or any other medications. Given its impact on the kidneys and electrolytes, those with kidney disease, diabetes, or gout should discuss potential risks and benefits with their doctor. If you're pregnant, planning a pregnancy, or breastfeeding, it's crucial to consult with your healthcare provider. Regular monitoring of blood pressure, kidney function, and electrolyte levels is advised for those on furosemide. You should not take furosemide if you have severe kidney disease or are unable to urinate. It's also important to inform your doctor if you have liver disease, an electrolyte imbalance, high cholesterol or triglycerides, lupus, or an enlarged prostate. Additionally, tell your healthcare provider if you are on a low-salt diet or if you are allergic to sulfa drugs. Before starting the medication, inform your doctor if you have ever had heart problems, diabetes, gout, or if you are scheduled for any surgeries or medical procedures. It's also essential to let your healthcare provider know if you drink alcohol very often, as alcohol can increase certain side effects of furosemide. Side effects: all medications can have side effects, and furosemide is no exception. Common side effects include increased urination, dizziness, or lightheadedness, especially when getting up from a sitting or lying position. Some individuals might experience dehydration symptoms such as dry mouth, thirst, and reduced urine output. There's also a potential for electrolyte imbalances, which can lead to muscle cramps, weakness, and irregular heartbeats. Furosemide can cause more serious side effects like hearing loss or ringing in the ears, especially if taken in high doses or in conjunction with certain other medications. There's also a risk of severe allergic reactions, which can manifest as rash, itching, swelling, severe dizziness, or trouble breathing. Furthermore, furosemide may cause serious side effects including kidney problems, liver damage, high blood sugar, hyperglycemia, low blood sugar, hypoglycemia, when combined with insulin or medicines that increase insulin levels, serious urinary tract infections, and low blood pressure. It's also important to note that furosemide can lead to severe dehydration, especially if you don't drink enough fluids, if you vomit, or if you have diarrhea. Symptoms of severe dehydration include dry mouth, extreme thirst, urinating less often, dark yellow urine, dry skin, and feeling dizzy or faint, especially when standing up. Always consult your doctor for medical advice about side effects and report any new or unusual symptoms. Interactions: furosemide might interact with other medications. It's crucial to inform your doctor about all medications, supplements, and herbal products you're currently taking to avoid any adverse interactions. Notably, furosemide can interact with other blood pressure medications, lithium, certain antibiotics, and medications that can affect potassium levels. Dosage: correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking furosemide. Regular monitoring and periodic checkups can help ensure the drug's efficacy and safety. The typical starting dose for treating edema in adults is 20 to 80 mg per day, divided into 1 or 2 doses. For hypertension, the usual dose is 40 mg twice daily. However, dosages may vary based on individual health conditions and responses to treatment. Never alter your dosage without consulting your healthcare provider. Avoid. While on furosemide, it's advisable to stay hydrated to prevent dehydration. Given the potential for dizziness, it's wise to rise slowly from sitting or lying positions. As with many medications, it's recommended to avoid alcohol, as it can exacerbate certain side effects. Additionally, avoid taking furosemide close to bedtime to prevent nighttime urination. FAQ. Many wonder about the age restrictions for furosemide. While it's primarily prescribed for adults, it can also be used in children under specific circumstances and with appropriate dosing adjustments. It's always best to consult with a healthcare provider for any specific queries related to this medication. Closing. That wraps up our overview of furosemide. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.